I was wide awake while they were stitching me, and I was really screaming because the pain is out of this world.
Childbirth is often known as the miracle of life. But some women suffer lasting trauma from a procedure known as the husband stitch. What is this procedure, and when does medical care become a form of female genital mutilation? In this story, we investigate medical malpractice in the delivery room and the situations that have allowed it. In the heart of Lagos, Faith endured months of searing pain following the birth of her child. The horrifying truth? She had been given an extra stitch, which she later realized was not for healing, but for her husband's pleasure.
When my husband came into the room after the whole stitching, one of the, I don't know if they are nurses or midwife, I don't know how to refer to them, said to him, "Oh, we made it tighter for you." At that time, I didn't know what it meant, but I noticed that I had like this pain. I couldn't walk properly, so I had to be assisted to lie down on the bed.
This practice relies on a medical lie that an extra stitch is necessary for the restoration of the vagina. We asked consultant gynecologist Dr. Kudos Lawal about the concept of the husband stitch.
I'll say husband stitch, which sometimes is referred to as the daddy stitch, is a procedure that takes birth for a very long period of time. It's an extra stitch that is placed on the vagina during the process of repairing a tear or laceration or episiotomy that was given during childbirth. And the sole purpose for which this is done is to make intimacy pleasurable for the partner.
For Faith, the relentless irritation and discomfort from the extra stitch she got drove her to constant self-medication, desperately seeking relief.
I was advised to use spirit, methylated spirit, to wipe that part. I cleaned it until it healed, or so it looked. But the truth is that it didn't heal that way. After a while, it flares up. I start having like serious itching. Sometimes it looks like I'm having an infection there. So I had to like get an ointment. Whenever it flares up like that, I use the ointment to relieve myself.
To what extent does this unauthorized procedure impact a woman's physical and psychological well-being?
It has caused depression for a lot of women. They are in perpetual state of anger, depression, irritability. Some of them have to deal with actual medical issues such as scarring, infections down there, even uterine prolapse, because if the pelvic floor is affected, then it gets weakened.
Is this procedure worth it?
The area around my anus and my vagina, right, has been dry. It's still dry till date. Very dry. I can't even explain that kind of dryness, right? It was so, the first time we tried to have sex, it was really hard. It wasn't pleasurable. And I think for me to have sex right now, it's going to take a whole lot. My partner, who I'm no longer with, expressed the fact that, oh, it didn't change anything, in the sense that it didn't get tighter.
The fact that it's done on the presumption that it makes intimacy more pleasurable to the partner is a myth, because this has not been substantiated. Rather, it can be associated with complications, one of which is dyspareunia, when intercourse becomes painful for the woman and even can be for the partner as well. Then on the end of the spectrum, there can be what we call gynetrasia, in which sexual intercourse is almost impossible because the vaginal orifice has been tightening beyond what can allow for intercourse. It's essentially a form of female genital mutilation and should be discouraged.
We traveled to Kotangora, Niger State, where we met Hassana, a mother of 5. Like Faith, Hassana told Dubawa that intimacy has been unbearable since she got the husband stitch.
The thing I feel pain, the place they pay me, so now it make me. I know people like it. What children what I get, I no get here. Why I can't born the 5th one? Now I can't get here. Now they console me. The thing pay me when I no born again.
And more often than not, this is done without the consent of the patients involved. they are often not aware that this has been done on them.
The time they saw me, I don't know. But my husband did it. I just wake up. I don't know whether they answer. But me, I know. As soon as I come house, I come take treatment, I take drugs. But before the place be here, I reach 3 months.
Dr. Idara frames the husband stitch in its proper context, not as a tradition, but as a clear-cut case of medical malpractice.
A lot of people have debated whether it's actually real because of how unethical it is, whether it's actually real, whether it actually happens. It does happen. But it is very, very unethical, and it is an injustice to the woman to be kept in a constant state of pain so that the man can derive pleasure during sex. It absolutely makes no sense.
I spoke to many other women who decried severe consequences but were too afraid to appear on camera. What measures can be put in place to safeguard women from this dangerous procedure globally?
And so I think when we look at the definition, the internationally recognized definition of FGMC, it is, any procedure performed on the external female genitalia for non-medical purposes, right? And the husband stitch falls within that. Anytime there is a law that addresses FGMC, I think the husband stitch should fall within that.
Different voices, same pain. For Hassana, Faith, and many others, when will this practice be banned?
It's good if they saw woman. They not be saying me they saw and make it tight because of the husband.
The whole idea of husband stitch to me is barbaric. In my own opinion, anybody who even thinks of it should be arrested.
The most disturbing finding: both Faith and Hassana underwent this procedure in accredited hospitals. Yet, when Dubawa questioned authorities on accountability, Dr. Modupe Adedeji of the Society of Gynecology and Obstetrics of Nigeria insisted categorically that this practice was carried out by non-professionals.
I don't think it is. You see it in the midst of gynecologists. It's obvious we have non-professionals handling our work, and people tend to believe them more. For instance, now, since we are talking about Sogon, as present now, Sogon is trying to also talk about traditional birth attendants and their role in the management of our pregnant women. So that means where it is happening is definitely not in our own palace. It's happening elsewhere. So the point is that we should continue to talk about female genital mutilation. So with this now, if it's loud somewhere, then we need to talk about it amidst us so that we can also make people understand what they are doing and what they are causing. For those women who have had that, then they need to also come forward so that we can help to correct whatever left of it that we can correct. Because as far as we are taking it, it can even be a cause of something that can break a woman's home. Because when we talk about coitus, that's sexual intercourse, it's a very germane thing in marriage. Really, very, very important. Probably we can get to discuss it amongst us, but then it's a form of mutilation, and that's female genital mutilation. And obviously, we have a voice on that.
When asked, hospital officials claimed ignorance, stating they don't know what it means. Faith and Hassana are not alone. Across the country, countless women face the same risk, rooted in an old practice that still lingers. The question is not whether this will end. The question is, when will it end? When we presented our findings to the Federal Ministry of Health, officials appreciated the report and highlighted its potential to expand the ministry's knowledge on the issue. However, they failed to respond when Dubawa tried to follow up.